I'm John Smith, the dog doctor. In this segment, I would like to continue our conversation about chronic disease. As you will recall, we define chronic disease as any disease condition that is present for 3 or 4 or more months. And I would specifically like to talk about chronic disease from a functional medicine point of view. Functional medicine views chronic disease from the perspective of physiology and not pathology. And what I mean by that is functional medicine is concerned about finding imbalances in the body and correcting them. Conventional medicine, with its pathologic point of view, is concerned about making a diagnosis, finding the one thing that is wrong and the one drug that will correct the situation. And the nature of chronic disease is such that that is not the way things will operate optimally. In functional medicine, we look for disturbances in what we call the 8 imbalances. The most important of the imbalances is in the gastrointestinal tract. The reason that it's so important is because in mammals, 75% of the immune system is in the GI tract. It's where the rubber meets the road. And in my approach to chronic disease, one of the first things that I'm concerned about, knowing that the importance of the gastrointestinal tract and the immune system, is to assess the possibility that the dog may need a hypoallergenic diet. And as it turns out, all dogs that I've seen with chronic diseases, especially skin conditions, allergies, chronic ear infections, food hypersensitivities, play an extremely important role in many of those conditions. Oftentimes, if the diet is corrected, the whole situation is resolved. And the way I do that is through a blood test. And basically what we do is measure IgE antibodies against 32 specific food components that are the most common things put in commercial dog and cat food these days. And basically what really happens is that if an animal is hypersensitive to a food, the immune system reacts and creates antibodies against it, which contributes to inflammation in the body. In conventional medicine, allergies are discussed in terms of pollen allergies and food allergies. And when you think about it, I don't think the body makes any such distinction at all. It's just all inflammation. The comparison that I use, it's like a volcano under the ocean. How many volcanoes are under the ocean in this planet? Nobody knows, and really nobody cares until they become big enough that they stick up and boats have to go around them. And our approach to things is to resolve the food issue and remove half the mountain or 3/4 of the mountain, and then the boats don't have to go around it anymore. And the way we do this, again, is through a blood test. And what I have discovered, due to my own experience with my own health problems, specifically trigger finger, is that one has to interpret the test much more strictly than conventional medicine typically does. Dealing with chronic disease, it is important to make an assessment of the amount of inflammation in the dog's body. When one realizes how important the GI tract is in food, it becomes readily apparent that the way to deal with chronic problems is to assess hypersensitivities to food. This is done with a blood panel, and basically it measures IgE antibodies to 32 common food ingredients that are put in most commercial dog foods. And the thing to remember is that when you add up many low-grade hypersensitivities, it amounts to a great deal of inflammation. What we typically find is out of 32 things, the average patient will quite likely be hypersensitive to 15 or 20 different ingredients, rather than highly allergic to 1 or 2 ingredients. And the typical pattern we find, well, there really is no typical pattern. It is not, out of the several hundred dogs I have tested, I can't say that. The most I can say is that chicken and oats are the 2 most common offenders, but they're the most common things in dog food. It's not simply that the dog is allergic to all meats or all vegetables. It's many different low-grade sensitivities. Remember, no 2 dogs are alike, no 2 cases are alike. If your dog is suffering and has obscure symptoms of chronic disease, functional medicine can often find the answer.